Well, hi, everybody, and welcome back. All right, I have some fun news for you. So you've been watching a program all about stem cell therapy and people getting out of pain, and I think you heard me say several times that I'm suffering. I suffer with my knee and my shoulders, but mostly my left knee. Well, I did it. I listened to what everyone said and said, you know what, I have to jump in. I went to Jill's lecture, I heard all about stem cells, I did my own research, and I did it. And so here with me now, and this is very exciting to share, is the physician's assistant who did the procedure. Please welcome Stephanie Godey. Hi.
Nice to
How are
see
you? So, stem cell therapy. You and I met a couple of days ago, and I'm excited. I mean, it was relatively painless. It was fast. I was very surprised.
You did great.
Well, thank you. Now, when you first heard about stem cell therapy, what did you think?
It's too good to be true. Like when you go to school, you learn about the treatments for arthritis, and you learn it's surgery. Like arthritis is degenerative. It's never going to get any better.
Right.
It's just going to get worse. You've heard of like hyaluronic acid, what people will do for their knees. Well, that makes it plateau, but if you don't keep up to date, it starts degenerating once you're out of that time frame. So
now, let me ask a question. As a physician's assistant, what is your job normally prior to stem cell therapy?
I worked in nursing homes. I guess I actually worked in physical medicine before I came to work with Dr. Howe. And I was in skilled nursing facilities, and it was really depressing because people their baseline was bad, and they would get to their baseline, which is ill. And that was sad, and there wasn't a place of wellness. So working for her has been a complete change, and you actually see people get better and their life improve.
How do you describe what stem cells are?
Well, when I explain it, I just say that they're cells that rebuild tissue, and they just know what to become. And so I kind of give it an example. Like if you were to get a cut, your body has your own healing properties to it. So your body's going to heal your cut. So when your chemical messengers get there and are there to heal that site, they have a brand new soldier that are ready to fight for them and become whatever they need to do, or become whatever they need to become, essentially.
And so, where does the stem cell come from? Where do you get this from?
This is coming from the placental stem cells, so they're coming from the placenta, and you don't have to worry about DNA or having like a risk of having a reaction to it, because it's coming from the side of the placenta that doesn't have DNA. So there's a side that faces the baby and the side that faces the mother. So the side that faces the mother has the DNA part on it, and the side that faces the baby is undifferentiated, essentially. Those cells don't have any background, essentially.
So basically there's no rejection is what I found fascinating.
Right.
Okay, so you gave me an exam. I mean, I'm going to give you guys, literally, this is my own personal testimony, and I don't normally do that in the show, but I got so excited listening to everybody, literally going from 9 in 10 pain to nothing. Now, that's never been heard of, I'm sorry. With no side effects, with no surgery, with no drugs, you're like, wow. I mean, when people come in, are they just stunned about this is even possible?
Yeah, because a lot of people think like this is their last hope. They don't want surgery, or some people aren't even candidates for surgery, and they think the doctors say, I'm sorry, you have to live with it. I'm sorry.
I've heard of that. Believe me, I heard that. I was 34 years old when I first hurt my knee, and my doctor said, don't do surgery because you can be without an ACL. You know, how active could you be?
Right.
20 years later, I ski, I run, I jump, I dance, I do everything. I hike. I want my knees.
Right.
So I did this. I took the leap yesterday, or 2 days ago, showed up in your office, and there she is with her little handy treatment kit, and said, just give me a couple of minutes. And you're like, really? It was over like that.
Yeah.
It was relatively painless. I went home. There's no bandages. There's nothing. And so how long before I really start to feel something?
Everybody responds differently. Some people have an amazing pain relief in the first couple of days. It's the anti-inflammatory effect that's happening. But sometimes people take a little bit longer. I'm not sure if you've talked with Hub already. He actually had really great results. He said he responded about in like 3 weeks, but everyone's a little bit different. It also depends on the severity of the arthritis and how good of a healer you are. There's criteria that you would meet, but we obviously cleared you.
So far, I mean, I wore high heels today, which you're not supposed to wear. And I'm not noticing anything, so I'm thinking, oh my gosh, because I'm forgetting how much, I mean, my pain was so bad it would keep me awake all night. Yeah. And that's one of the problems with knees is that, and you don't like walking with your kids, you don't like doing anything.
Right.
And so I'm gonna come back to you guys, if you don't mind, in a couple of weeks, maybe a month or two, and report back to you on how well my knee is doing, because I have super high hopes.
I would love to hear back from you.
All right, so you see a lot of patients. Do patients come back after a period of time and give you their results?
Yeah, they do. So getting to hear people, because I do follow-up calls as well. So like I get to hear, even without them coming in, how well they're doing and how much their life has changed. And now I had some people who come in with needing walkers who are now using canes, and they're like, I feel like I almost don't need this now, and it's amazing. And I've been using a walker for however many years. So it's just wonderful to hear, and I love to see improvement in people.
How does it make you feel to be part of this?
I feel very fortunate. So stem cell therapy is very cutting edge medicine, and it's not many people are getting to do it yet, because a lot of physicians or practices don't want to go into the new medicine. They want to wait until it's been out for years and years and years and years. And I'm just very fortunate to work with this practice.
How long was your training to know what to do, where to inject?
The training was you learn in school, and then essentially your supervising physician shows you exactly what you need to do. And to be honest, learning how to do joints wasn't very hard, so it was very, very quick.
Really? I'm almost giddy going, okay, that was not a big deal, but it is if I can start to walk.
Right.
So help me help other people out there, because there's people listening to this show who have made a decision, they're skeptical. They're like,
Right.
oh, I don't think it's for me. What would you tell them?
Well, I would personally actually do an evaluation, listen to their story, listen to their past medical history, and then let them know if they are a good candidate, and if they are, explain to them why.
So who is stem cell therapy right for?
So for people who have arthritis or like meniscal tears or any soft tissue damage, a lot of people will come in for like tendinitis or even neuropathy, which is really great, because if you look on like what's the treatment for neuropathy, it's only symptoms treatment. It doesn't tell you that there's a cure or that your nerves are going to regenerate or that anything is going to get better. You just kind of can manage your symptoms. And this actually regenerates nerves. Nerves are obviously very complex, and they take a while to regenerate, but they do with stem cells.
So many people have gotten so many amazing results. Do you have an example you can share with us?
Yeah, so we have a patient, Linda. She actually had stem cells done before coming to us in her ankle, but it was from her own body, and she had good results, but she wanted it to be less invasive this time. So she actually had her left hip and her left thumb done, and she responded actually within days. So she's one of our lucky ones who actually gets the instant anti-inflammatory effect. And her pain started off around like an 8 or a 9, and now it's pretty much not there, like 0 to 1. She's her days that maybe her hip might hurt a little bit, but not really.
Does she have arthritis in her hand?
Yes, and she has no pain in her thumb right now, and actually her other thumb is more bothersome than the one that really was giving her all that pain that she wanted to invest into stem cells for.
That is awesome. All right, I'm going to ask you to dig and find me somebody. I'm loving these stories. Do you have somebody else?
Well, one of the people I was talking about that was walking in with the walker, Phyllis, I actually just spoke with her yesterday. She was walking in with a cane. She's walking so much better, and she's having pretty much amazing results she's someone who had very severe arthritis. And
in her hip? Or
it was actually, hers was her knee, and
okay.
she actually had really severe arthritis that she really didn't want to go under the knife and have surgery, but she chose to do stem cells instead, and her road is a little bit longer because of it being so severe, but her husband actually reminded her, saying, you could barely walk with a walker, and you're walking with a cane now.
How old is she?
She's in her 80s.
See, this gives so many people so much hope. We are living longer, but it's only fun if we're living better.
That's right.
And I do want to share with our audience that we're not going to make any promises. One, it's not for everybody. But if it is right for you, 1, you should come to the seminar and hear about it. 2, visit the office, talk to doctors, see if this works for you. It is a relatively painless, simple procedure. And you get to, I'm gonna give you my honest truth in a couple of months, so I'm excited to see how that goes. And you've heard lots of testimonials on the show. I think that you're amazing. Thank you for being so open and so excited, because when you're in their office in particular, they're over the moon. They just, if it works, you get to do it. Right. But you have to make that decision for yourself. You need to be responsible here. So get educated, learn about it. But I got to tell you, if you're in pain and you're suffering, like me, you might not have any other place to turn. This could very well be the answer that you're looking for. Stephanie, I want to thank you so very much. I'll see you, and I'll call up and tell you how I'm doing, and I'll see you guys back in just a couple of minutes.